Hi, it's Michael from Planet Naturopath. In this video today we're going to talk about small intestinal bacterial overgrowth, or SIBO test for short, how to go about getting tested in Australia, and what the best treatment options are. So let's have a look at the video now. So what exactly is small intestinal bacterial overgrowth, or SIBO for short as we'll call it from now on? Everybody has trillions of bacteria in their large intestine. Most of these bacteria play a valuable role in keeping us healthy. But we should have very few bacteria in the small intestine. And if we do get an overgrowth of this bacteria, it's called SIBO. This overgrowth of bacteria produce gases, methane and hydrogen, which create a lot of symptoms like bloating, gas, damage to the intestinal mucosal wall, which can lead to a lot of other systemic health problems, which we'll go into in a minute. So what causes SIBO? There's a number of risk factors for the development of small intestinal bacterial overgrowth. One of the biggest one is the Western diet, what people eat in Australia, and the processed foods, high in carbohydrates, sugars. This promotes fuel for the bacteria in the small intestine. If you don't have enough digestive enzymes, and this can be with people who are older, people who are taking medications, you're not breaking down the food, which is also easily fermentable and creates more food for the bacteria in the small intestine. If you have a motility disorder where the food is not getting pushed through the small intestine fast enough, this also leads to fermentation and food for the bacteria. So there's a lot of different reasons why people can get small intestinal bacterial overgrowth. It can start with infections, it can start with antibiotics, it can also start with other bacterial infections like Helicobacter pylori. All these predispose people to SIBO. Healthy digestion equals a healthy body. So if your digestion is not working well, this can also have effects on detoxification, which can affect brain health, skin health, hormones, thyroid hormones, sex hormones. They're all interlinked with the digestion symptoms. So if you're not digesting properly, it's not just digestion health that's going to go out of balance, but all aspects of your health. There's a lot of different symptoms of SIBO. The biggest ones are always bloating, sometimes associated with pain, gas, and either constipation or diarrhea, or for some people both. But there's a lot of other symptoms that can be caused by SIBO. The toxins can produce neurological symptoms. The intestinal permeability caused by the damage to the lining of the mucosal membrane can lead to autoimmune conditions, skin problems, asthma, and also decreased absorption of nutrients, particularly B12, iron. So having chronically low levels of these can be an indication that there's something wrong with the absorption and possibly SIBO. So these are the typical symptoms. You don't need to have all of these symptoms, but the predominant ones would be the bloating, gas. Other common ones are fatigue and brain fog, all relating to the digestion. There's many other symptoms associated with poor digestion health and a disruption in the gut bacteria. We've already touched on a few, but other ones are allergies and asthma, acne, fibromyalgia. Even heart disease is associated with disruption of the gut microbiome. So how to treat SIBO? Most often when you go to a doctor with symptoms of bloating, gas, constipation, diarrhea, you're simply told that you have IBS and you have to put up with it. Or you may get referred for a colonoscopy or a gastroscopy. Often these just show up no structural abnormalities. So once again you're told you have IBS and it's time to just put up with these symptoms. The Planet Naturopath solution is to get an accurate diagnosis of what is happening. The first step with this is doing a SIBO test. Another test I often recommend is a comprehensive digestive stool analysis. This can rule out other infections, bacterial, parasite, candida, helicobacter, as well as looking at how many good bacteria you have in your digestion, system? Do you have enough digestive enzymes to break down the food? So the Comprehensive Digestive Stool Analysis, or CDSA test, is a great test along with the SIBO test to work out what is happening for your digestion. The next step is to treat the cause of the symptoms, which is the bacteria, and removing them. And so while we try to treat the cause, we're also trying to treat the underlying cause of why it started in the first place, whether it's a lack of motility, lack of digestive enzymes, low hydrochloric acid, or some other type of infection. Once the infection's been removed, we want to repair the damage to the intestinal wall, improving the leaky gut. And this will help with the absorption of vitamins and minerals. The best way to test for SIBO is a simple breath test that can be done at home. It can be posted from anywhere in Australia, and safe and reliable, and even children can do it. Results are ready within a week. There's also an optional test to measure fructose intolerance. The SIBO test measures the levels of hydrogen and methane gas, and these are only produced by the bacteria in the small intestine. So depending on which gas is predominant will help determine the best treatment strategy, and also how much of the gas will indicate just how much of the overgrowth of bacteria you have. Treatment can be anywhere between 8 to 12 weeks. The cost of the SIBO test in Australia is $345, and this includes a 30-minute consultation to explain the results and help you with a customized treatment plan. You'll be given a written report detailing the underlying cause and a treatment plan to improve your digestion health. You'll be given a separate sheet on the dietary guidelines to follow, and this is just a temporary diet for the 8 to 12 weeks of the SIBO treatment plan. You also get access to the best quality practitioner products to ensure great results. Thank you for watching this video, and if you'd like to order a SIBO test today, just click on the link below this video. You'll be taken to a web page where you can order a test now. This is the first step into getting your digestion and your health back on track. I look forward to working with you.